Although not in place as of this taping, many employers have been asking questions about a possible new standard by OSHA to address protecting workers from contracting infectious diseases at work, mainly COVID-19. In this segment, we will talk about the new National Emphasis Program on COVID-19 developed by OSHA in March of 2021. We will give you just a brief overview when we come right back.
Welcome to this episode of Workplace Health, Improving Employee Health and Productivity, with President of Workplace Health, Inc., Shanna Dunbar.
In March 2020, OSHA produced a document 3990, the guidance on preparing workplaces for COVID-19. It was a very useful resource, and I think it provided valuable information for employers who had not previously developed any kind of program around a pandemic response. The guidance was intended for planning purposes. The guide would help identify risk levels and workplace settings to determine appropriate control measures to implement to reduce the spread of COVID-19. And in my experience, those employers who took this guidance to heart and implemented its recommendations have had very few problems with workplace exposures. On March 12th of 2021, in response to the President's executive order, OSHA announced a National Emphasis Program, or NEP, on COVID-19 in the workplace. The NEP is intended to focus OSHA enforcement efforts related to COVID-19. The purpose is to focus on hazardous conditions that put the largest number of workers at serious risk or close contact exposures to COVID-19. The NEP identifies two groups of industries for OSHA's increased attention. The primary target is mostly businesses in healthcare, nursing homes and hospitals, and a handful of other industries that have high potential for workplace exposure, like the meat processing facilities, grocery stores, restaurants, and the like. The secondary target industries list different types of manufacturing. If you are a business within these targeted industries, it means that OSHA may be making a more focused effort at random scheduled enforcement inspections of your business. Specific criteria for inspections are not listed, but we would assume inspections would happen if there were any fatalities, exposures, or complaints related to insufficient COVID-19 controls. This document gives some guidance in areas of focus that might be included in the inspection, and I'm going to list these for you here, just to give you an overview in case you are in one of these targeted areas. So on a random inspection, OSHA could focus on any one of the following. They are going to look at your plan. If there is an infectious disease outbreak in the workplace, meaning they would want to see a written plan that you have in place to identify ill persons and direct coworkers who have had contact accordingly. Next, assess workplace hazards and determine what controls or PPE are needed for specific job duties. Of course, this is standard OSHA language, just to be sure you're considering also an infectious disease when you're considering other hazards. Next, consider improving engineering controls, including building ventilation systems. We know, for example, that COVID-19 is much less contagious when there is a supply of fresh air or people are outside. So evaluating ventilation would be recommended. Next, we look at to ensure that employees are wearing their face coverings in accordance with CDC guidance. Hopefully, this is a habit at your workplace now. Next, we would look at actively encouraging ill employees to stay home. How do you do this? Is it clearly communicated? Do employees know to stay home even if they have just a cold? Consider conducting daily in-person and daily health checks, so like self-monitoring or a simple daily temp would be fine. Accommodate employees through physical distancing or remote work, meaning, of course, keeping workers 6 feet away from each other and allow workers to work remotely. Next is emphasize respiratory etiquette and hand hygiene by all employees. What kind of reminder signs do you have up? Again, the focus is likely going to be on the communication. Do people know to wash their hands? Next is perform routine environmental cleaning to disinfect shared surfaces. And again, hopefully that's been in place for a while. So I hope this short video has been helpful to you in understanding this new OSHA National Emphasis Program. As of right now, we don't foresee a new OSHA standard related to the topic, but please keep your eyes and ears open as this may change. If you would like us to review your pandemic plan program, please do not hesitate to give us a call. We'd be happy to review and provide some valuable feedback. I know regulations can be a bit of a nuisance, but they are in place for the health and safety of the entire workforce, which is never a bad idea. Now go make it a great day.
Thank you for watching Workplace Health. For more great information, visit www.workplacehealthinc.com.